morning. Today we will study normal pressure hydrocephalus. First, let's read this case together. We have a 70-year-old male, forgetful, so he's having dementia. He has trouble walking, so problem with the gait, and he has a history of recurrent perianal sores. What's your diagnosis? He's asking about the diagnosis. Now we can see from the case that we have a triad. The triad is dementia. He's forgetful. This is the first one. And wide gait. He has trouble with the walking. Perianal sore. It's caused by recurrent urinary incontinence. So he's having urinary incontinence. All this triad, the three symptoms, this is the triad of normal pressure hydrocephalus. Once we see these three symptoms together, we should think immediately about normal pressure hydrocephalus, and we can make sure about the diagnosis when we see this CT scan picture. See, this is the normal ventricle, small and tiny. The normal ventricles in the brain. See this one? Very huge and large ventricles. This is what? This is normal pressure hydrocephalus with enlarged ventricles. See? Very enlarged ventricle. The black one is the ventricle, like I'm circling around it with the red pen. This is the large ventricle, okay? This is the normal brain, and here is the normal pressure hydrocephalus brain. How to diagnose? We will use non-contrast head CT scan, and we will see the enlarged ventricles, obviously. Lumbar puncture will show us normal pressure hydrocephalus, hence the name. It's a normal pressure. So when we say normal pressure, we mean there is no signs of increased intracranial pressure. When we have signs of increased intracranial pressure, for example, papilledema, this is not found here in normal pressure. It's called normal pressure, that's why. So when we do the lumbar puncture, it's just normal pressure. We don't have a high opening pressure. Treatment, we can treat the patient by lumbar puncture, continuous lumbar puncture just to drain the fluids, or we can do the final thing, which is ventriculoperitoneal shunt. Okay, this is the definitive. It's a potential treatable form of dementia. It's one of the treatable form of dementia, which is caused by impaired reabsorption of the CSF. This is the cause of normal pressure hydrocephalus. Okay, and we should know that it is a treatable form of dementia. It's not a permanent. We can treat the dementia because he's forgetful. And that's it for normal pressure hydrocephalus. Bye bye. See you in the next video.